What is depression? Prolonged sadness, disinteractivity with things we used to love, decreased concentration, excessive fatigue, and such states can be signs of depression. It changes our feelings, our thoughts, and our behavior. Depression can be associated with emotional and physical problems. Symptoms of depression: feelings of sadness, emptiness, and despair, getting angry and suffering from banal issues, disinterest and reluctance to do things that we've been interested in before, sleep disorder, insomnia or excessive sleep, feeling tired or lacking energy even without doing heavy work, drastic changes in appetite and weight, unexplained appetite or obesity and sudden thinness, anxiety and restlessness, guilt for the small tasks of the past, reduced concentration, reduced problem-solving power, reducing decision-making power, thinking about death and suicide, physical pain without a specific reason. Physical symptoms of depression and anxiety: sleep problems in depression, chest pain in depression, fatigue and lack of energy in depression, muscle and joint pain, gastrointestinal discomfort in depression, headaches, changes in appetite or weight in depression, low back pain, anxiety and turmoil, sexual dysfunction. Depression symptoms in women. Women, unlike men, have a self-destructive look and feel guilty when they have depression. Depressed women usually experience excessive sleepiness, overeating, and weight gain. Of course, women in general are more susceptible to depression and may develop mild depression during menstruation, pregnancy, and menopause under the influence of hormonal changes. Postpartum depression is also very common in women, and 1 in 7 women develop postpartum depression. Depression symptoms in men. Depressed men usually have fewer symptoms of hopelessness and self-destruction, and instead complain constantly of fatigue and difficulties sleeping. Feelings of anger, hypersensitivity to other people's behavior, rapidly losing interest in work and things that entertain them are common symptoms of depression in men. Men with depression show aggression, substance abuse, and dangerous behaviors. Symptoms of postpartum depression: crying more than usual, feelings of anger, stay away from family and loved ones, insensitivity towards the baby, having the feeling of hurting the baby, having doubts and guilt about not being a good mother. Symptoms of severe depression: symptoms such as suicidal thoughts, getting away too much from friends and family, feeling too desperate, trying to commit suicide, buying guns, poison and viewing suicide videos, and self-harm, injuring yourself, starving the body, overdose, are among the warning signs for major depression in person, all of which are treatable. Menstrual depression. Menstrual depression is a common phenomenon among women due to changes in their body hormone activity levels. This type of depression usually does not have many negative results and effects on the person and can be avoided by performing sedative activities such as resting, stretching movements, juxtaposing with relatives, and other negative effects. Diseases and disorders that can worsen due to depression include arthritis, cardiovascular diseases, cancer, diabetes, MS. So think about treating it as quickly as possible. Main causes of depression: changes in chemicals in the brain. Certain substances in the brain affect human mood. Disrupting the balance of these chemicals in the brain is one of the most important causes of depression. Genetics. Depression can be hereditary. For example, if one of the identical twins develops depression, the other 70% may be affected. Character. Those with low self-esteem, those who don't know how to manage stress, or people who are totally pessimistic are more prone to depression. Environmental factors. People who are exposed to violence, discrimination, abuse, or poverty are more likely to develop depression. Other causes of depression: taking some medications, underlying disease, poverty and economic problems, death and loss of loved ones, alcohol and drug use, postpartum depression, stressful jobs, divorce and separation, being alone, deficiency of certain vitamins in the body. Treatment of depression: Exercise even if it's half an hour of walking a day. Consumption of nuts. Consumption of fruits and vegetables. Consumption of fish and other seafood. To meet those we love. Listen to happy music. Friendship with happy people. Travel and tour nature. Don't think about the past. Change home decoration. Go to the market and shop, especially for women. Help people. Expecting too much from yourself and others. Do the things you love. Referring to a psychologist. Live in the moment and don't be afraid of the future. Less use of internet and technology. Daily bathing. Wearing brightly colored happy clothes. Having regular sex. Aromatherapy, using fragrances. Procedures that only a specialist doctor should do for you, such as RTMS, ECT, ketamine therapy. Golden tips. Follow the techniques below. Regular exercise. Get enough sleep. Follow-up treatment. Reduce stress. Intimate relationships with others. Spend less time in the virtual world. Reduce your daily tasks and conflicts. Avoiding toxic and negative people. Having the right diet. Having a healthy weight. Treatment of chronic diseases. Avoiding unnecessary medications with side effects. Preventing drug and alcohol use. Stop smoking.